Testing for molds, biotoxins, and CIRS, also known as chronic inflammatory response syndromes. Now, our forefather in this area is Dr. Schumacher, Richie Schumacher, and he uncovered how genetically susceptible people can develop a condition which is known as chronic inflammatory response syndrome, also known as CIRS. And they develop this multi-system, multi-symptom illness. Often patients are diagnosed with conditions with chronic fatigue syndrome or fibromyalgia or even Alzheimer's disease. They, in fact, later been diagnosed with CIRS and their symptoms improve upon CIRS treatment. The exposure could be associated with perhaps interior environment, for example, water-damaged buildings. So the complex mixture of contaminants that present in the air and in the dust in these wet buildings form toxic chemical stew, which we typically would know as mold. So fungi, bacteria, spores, all of these mold and biotoxins and VOX, which is also known as volatile organic compounds, contribute towards the mold picture in these chronic complex inflammatory health conditions. So to test for molds and biotoxins and CIRS, one can identify the actual mold. Now, that can be done through a mold and biotoxin panel, and this is based on Richie Schumacher. He uses various gene markers, C3A, C4A. These are complement genes, leptin, MMP9, which is metallothionein protein, MSH, which is melanin hormone, TGF-beta1, VEGF. These are all various markers that are associated with mold specifically. Now, you can also take a nasal swab and you can identify both the bacterial and fungal cultures through what we call a multiple antibiotic resistance coag negative staph infection. So you can identify both bacterial and fungal elements through a nasal swab. You can even take a sample of the dust in the room that is perhaps infected with mold. You might want to take a sample of the building material and send that off to the lab for mold and biotoxin assessment. You might want to measure the exact amount of mold in your body, and you can do that through a mycotoxin panel by identifying ochratoxins, aflatoxins, and trichothecenes groups, as well as you can identify individual molds. Which mold is it? Is it a aspergillus, or is it a penicillium, etc.? These are molds that you can actually identify through a blood test as well. Now, you can also, if you're not sure, is this mold or is this Lyme, or do we have dinoflagellate infestation? We don't know, but we've got chronic inflammatory issues. You might want to use an overarching test, which is called HLA-DQ-DR genetic studies. And this identifies your HLA-DQ and DR molecular analysis, and through these particular gene profiles, whichever genes are expressed, so each gene will have the availability of expressing a specific haplotype. Both HLA-DQ and DR will express a haplotype, creating a band. That band is then associated with a specific condition. It could be associated with a specific condition like chronic fatigue, or could even be Lyme, could be post-Lyme. You may have been exposed to a tick-borne illness in the past, or it could be mold associated. So there's a number of avenues to assess this, and this is obviously detailed in many webinars, one of which is found in our Learning Center. So to determine which test is right for you, please speak with your healthcare professional, and or you may want to contact us to order a test or interpret your results, or even seek guidance on your specific health conditions. So to learn more, check out our Learning Center for an in-depth education on this very topic. Thank you.